I'm like so struck by this report, the Health of America report, that says you think things would be getting better. Since 2018, the rates of the morbidity, maternal morbidity, the rates are on the rise overall, and that pregnant women in the United States are more than twice as likely to die from complications related to pregnancy or childbirth than those in most other high-income countries in the world. I mean, it's almost hard to believe those statistics.
Right. And part of it is that, you know, in our healthcare system, if you have money, you'll get really good care. If you're white and you have money, you get really, really good care.
Okay.
And a lot of it is there's a lot of stuff that has to happen beforehand before you deliver that child. And that's not happening. And there's not structure in place to support those individuals financially to get them the appropriate prenatal care that they need. You know, we were talking about how if you don't have paid family leave, that affects the whole family. I've had patients of mine where the mom has to go right back to work, so grandma, the mother of the patient, has to watch the kids, so she can't come in to see me, and the children can't get in to see the pediatrician because there's no one that can drive them there. So it's this cascading effect.
Absolutely. Dr. Adegoke, I mean, you're an OBGYN. Is part of this problem not only that we need to change the way we teach in medical school, but we need more doctors who are of color so that they have a better sense and certainly less bias, don't you think?
Absolutely, absolutely. This is something that starts even before medical school. I was listening to Dr. Proctor talk about this study where they had different providers look at clinical scenarios, and the care they gave was different based on the color of their skin. There's another similar study done recently where they asked young medical providers, so medical students, residents, fellows, you know, about certain beliefs that they might have about people based on the color of their skin. And the results are shocking. There are people out there early in their careers practicing medicine who believe, for example, that Black people have thicker skin, that they don't feel pain in the same way. And so when you realize that people have those beliefs, it makes it very clear why someone would present in labor and have their pain ignored by their healthcare team, because the team doesn't actually believe that they're suffering as much as they might think if the person looked different. What we need to do as a healthcare system is stop denying the effects of racism on the care that we provide. The patients are on to us. They know this is happening. There just really isn't a point trying to pretend it doesn't happen anymore.
Wade, you're like shaking your head yes to the whole thing.
I would have offered a hearty amen. And I think it is the fact that the growing diverse voices in healthcare are being heard, received by, and being responded to by other leaders within the healthcare community. When in doubt, consult the experts. It's the folks in the community who are experts on their care. And I think that the engagement of the healthcare system with the non-health system, the fact that it is now common, it was unheard of 15 years ago, but now healthcare is stationed in barbershops and in beauty salons, in church basements, in neighborhood block associations. We have the ability to restore a sense of the community and healing as principle to healthcare. And I'm really excited about the prospect of making that real for the someday grandchildren of mine who will safely arrive.